Priyanka, one of the mentors for study MRCPI. So we are doing the OMR series, that is OSCE Made Ready series part 2, which will be covering the most important stations covering the MRCPI OSCE exam. So do like and share and subscribe Study Medic channel, and also press the bell button icon to get the recent updates on the recently added videos. So today we will be doing a structured discussion task on cystic fibrosis of the maternal medicine module. So do remember that the feature depends on you. What do you do today? Okay. So this is a okay. So this is a structured discussion task where patient is Mrs. Claire Mark, who is 35 years old, Caucasian woman, and she is married for 1 year, and she is planning for her first pregnancy, and she is a case of cystic fibrosis, and she wants to know further plan regarding her preconceptional care and the pregnancy plan.
Okay, hi Priya. So let me keep the timing so that it will be on the same page. Okay. So this is a very important task. Yes, dear, please go on. Yeah.
Hello, I am Priyanka, one of the candidates for the exam. I have read the scenario and I'm ready for the discussion.
Okay, thank you, Priyanka. So can you please tell me what important information you want to know from her?
Yeah. From Mrs. Claire. So first I want to introduce her myself, and then would like to confirm her identity, and then would like to know few important information like her age, and especially her ethnicity. So as she is Caucasian, so they are at increased risk of having cystic fibrosis. Almost 1 in 25 they have the risk of carrier rate. So again, then I want to know her any chief complaints if she is having, like if there is any history of any repeated chest infections, or any history of weight loss or decreased appetite. Then her other than the cystic fibrosis, any other medical conditions if she is having any surgical problems. Then her last date of periods, when was her last date of periods, and is she on any contraception right now, because she wants to get pregnant. So till now, is she on any contraception? Then her obstetric histories, that she has been pregnant before, and if she had been pregnant before, so what was how is the child, is the child also suffering from this condition, because it is an autosomal recessive disease, so that I want to know. Then her family history, any family member having cystic fibrosis. Also her husband's history also, I want to know the husband's age and ethnicity, and also anyone in the and the career status of the husband, and also anyone in the husband's family is also having cystic fibrosis. Then again, I want to know her previous cervical smears are up to date, and how are the results, and what is her BMI. It is very important, because usually patients with cystic fibrosis, they usually have low BMI. So to plan the management for her preconceptionally, I want to know her BMI, her allergies, and blood group, and if she is any Jehovah's Witness, that I want to know. Then I would like to know her occupation, what does she does for living, and after signposting, I want to ask her about her smoking and alcohol and recreational drugs history. Then I want to know her support history, which is very important, because as we know that the cystic fibrosis patients have a decreased lifespan. So who are all are there to support her in her pregnancy and to take care of the child is very important, and psychological history I want to know.
Okay, so thank you. So actually, she is a known case of cystic fibrosis. Her mother also was a case of cystic fibrosis, and she has been under multidisciplinary team care. She had a multiple admissions due to respiratory tract infections last year, but this year she seems to be well settled. And her last menstrual period was around like 2 weeks before, and she's on a regular contraception. She uses condoms, and right now she has been started with the folic acid as well, and her BMI is 18, blood group is A positive. Apart from that, rest of the history looks fine. So now she's come back to you 6 weeks pregnant. Okay, so with all the respiratory functions, whatever done so far has been fine. So take me through, how would you manage your antenatal care?
Yeah. So as she's 6 weeks pregnant, so here as she's a case of a high risk pregnancy, her care will be under a multidisciplinary team, which will be consist of the maternal fetal medicine consultant and also her pulmonologist who will take care of the cystic fibrosis, also dietitian, also a physiotherapist and a specialist midwife and anesthesiologist geneticist will all be there taking her care. Then as she is 6 weeks pregnant and she is continuing folic acid, so I will tell her to continue the folic acid and also will do her booking blood test, which will also include additionally screening for diabetes, because the as we know that cystic fibrosis there is increased production of thick mucus and also there is increased sweat sodium. So because of this thick mucus production, there is increased chance of pancreatic insufficiency and hence they are at risk of developing diabetes. So I would like to screen for her diabetes, and if this comes normal, then again I would like to test her on at around 24 weeks. Then after booking blood test, then I would like to do the dating scan and afterwards an NT&B scan. And along with that, as she is a case of cystic fibrosis and her husband is a carrier, then I would like to offer them a genetic testing to know whether the child, the current pregnancy is affected by cystic fibrosis, whether it is a carrier or the pregnancy is affected by cystic fibrosis. For that, I will offer them a chorionic villus sampling, for which I will be sending them to the fetal medicine specialist. That can be done between 11 to 13 plus 6 weeks or around amniocentesis after 16 weeks. And after that, I will be offering her an anomaly scan between 18 to 20 weeks, and followed by that serial growth scans, because the fetuses are at increased risk of having fetal growth restriction. For that, serial growth monitoring will be done. For her, as her lung function is controlled, but she had multiple infections in the past. So I would like to offer her also, her BMI is 18, so I would like to offer her nutritional supplements which are non-teratogenic to have proper weight gain in pregnancy. And also would like to connect her again to her pulmonologist for the lung function tests and uh, to take care of the cystic fibrosis.
Okay, so one thing is like she was actually under MDT and her partner is also carrier. Okay, so in that case, how would you counsel the risk of baby having this cystic fibrosis?
Yes. So, as she's a case herself is a case of cystic fibrosis, so her both the genes are carrying the cystic fibrosis gene affected gene. While husband, there is one gene which is normal and one it's affected. So there is out of the four. Out of the 100 chance, there will be 50% of the babies will be carriers. That is, 2 of the 4 babies will be carriers, while 2 of the 4 babies will be affected. So I would like to counsel her that the chorionic villus sampling will definitely is a diagnostic test and will confirm whether the child is a carrier or affected by cystic fibrosis.
Okay, she's under MDT care and her FEV1 is 55%. She presents to you at 34 weeks for intrapartum planning. As of now, everything is going well. Take me through her intrapartum management.
Yeah. So her FEV1 is 55%, meaning that she is having moderate to severe disease. FEV1 is that is forced expiratory volume in 1 second. So here usually I would like to admit her and also for the bed rest, and also would like to check her oxygen saturation, because these patients are mostly prone for developing cyanosis and arterial hypoxemia. The saturation can be less than 90% in them, and also developing pulmonary artery hypertension. And for this, then I would like to connect her to all the multidisciplinary team members. And if the oxygen saturation is less than 90%, then she will be requiring oxygen therapy. And also for the two measures will be taken to avoid any pulmonary infections. And also for her, weight gain should be monitored as they are at increased risk of developing having weight loss. So for nutritional supplements will be given, and for the fetal part, there will be strict monitoring of the serial growth scans for the monitoring of fetal weight, because of the pancreatic insufficiency and the malnutrition. They are at increased risk of developing fetal growth restriction. So serial fetal growth scans will be done for them.
Okay. So now she delivered in the hospital and she was delivered by assisted post-delivery. Third stage was absolutely fine. Take me through her postpartum management.
Yes. So as she has delivered, so usually they are not at increased risk of having any increased risk of PPH. So postpartum management, there should be adequate support for these patients, and as they are malnourished, most of them are malnourished. So still breastfeeding is encouraged, and they should be started on the nutrition supplement if they have not started already. Still the studies show that the contents of the nutritions the pass through the breast milk, but still it won't affect, they are not teratogenic for the baby, and they must continue breastfeeding, and she should be provided with proper contraception, and follow-up care plan will be given after 6 weeks under the multidisciplinary team.
Okay, so and any special thing for the baby?
Yeah, so baby will be look for the baby, as the baby will be either a carrier or affected if she had continued the pregnancy, can be affected with cystic fibrosis. So baby will also be seen by the neonatologist, and also baby will be also look for any signs of any poor weight gain or failure to thrive, and genetics testing will be done further.
Fantastic. Thank you, Priya. That covers the 10 minutes. I think you did a fantastic job. Basically, you covered most of the things. But again, time is something which we need to look into, because the first question would take a little more time. So probably if you could work around that, I think that would be fantastic. And if you could see, I didn't give you the carrier status at all. So you could always ask, do I have anything about the partner? So, like probably sometimes the examiner might forget, or the examiner wants you to repeat that question. So that would save the time. Otherwise, I think it was good. And probably if you could go on a bit about the MDT roles as well, for example, in dietitian, what they would do, like a bit about, because we know that they are deficient in so many things, right? And a physiotherapist for just exercise to prevent the infections and so on. Otherwise, I think it was fantastic.
Thank you.
So yes, if you want to talk about any salient points which people shouldn't miss, please go on.
So yes, in history, it is very important to know in cystic fibrosis, to know the age and also to ethnicity of the patient, because some ethnicity, they are at increased risk of having cystic fibrosis carriers. Also, the main complaints like the patients may present with weight loss or repeated respiratory infections, or even sometimes respiratory failure. So those, knowing those complaints, any difficulty in breathing or decreased exercise intolerance, so that can be asked. Knowing the last period date and contraception is very important to know, because depending upon the severity of disease, they can try for the pregnancy of not knowing, that is very important. Any previous children affected, so previous obstetric history is important, family history, then the partner carrier status, ethnicity is very important. Also, BMI is very important, as they are at increased risk of having decreased weight due to pancreatic insufficiency and also malnutrition, and the support history is very important in these patients. So coming to cystic fibrosis, it is an autosomal recessive disease which is usually affects there is mutation in chromosome 7, and here there is increased production of thick mucus, and also there is increased sweat sodium. So usually the males are sterile, but in female there can be decreased fertility, depending upon the malnutrition, and also the fertility, they are increased risk of infertile, because there can be thick mucus. So that's why that can cause increased risk of infertility. And the intelligence is normal, but the lifespan currently is around up to 47 years, and some of them may require lung and heart transplantation. So this can be the symptoms like, due to thick mucus, there can be persistent cough, or there can be repeated lung infections, and there can be pancreatic insufficiency, which increases the risk of having diabetes and also weight loss because of malnutrition, and also there can be poor growth and decreased exercise tolerance. So there are some maternal risks of this condition. So like there can be increased risk if the and this condition, the risks depend upon the value of the forced expiratory volume. So this is the main predictor of how the maternal outcome will be. So in 1 second, so here the maternal risks include like having a hypoxemia or pulmonary hypertension or cyanosis or repeated risk of pulmonary infections and congestive cardiac failure and poor maternal weight gain. So preventing all the these things is very important while managing a case of cystic fibrosis. And usually the poor predictors for trying for a pregnancy are those who are having pulmonary hypertension, cyanosis, and arterial hypoxemia, especially if the oxygen saturation is less than 90%, or if there is a moderate to severe lung disease, meaning the FEV1 is less than 30%. So usually they should be discouraged on trying for a pregnancy. And then if when their optimal status is there, when there is a proper oxygen saturation and the FEV1 increases, then they can try for a normal pregnancy, natural pregnancy. So then also there are some complications like FGR, and having preterm delivery, it is almost around 10 to 25%. It can be iatrogenic or it can be due to malnutrition and increased risk of diabetes. So here pre-pregnancy counseling is very important, and tell to know the FEV1, and referring the role of MDT comes here. The pulmonologist especially to know the her pulmonary function and any history of infections, and to know any complications. So that is very important. Then the role of geneticist to know how the when she gets pregnant, so to tell the risk of the child being affected is very important by doing the genetic testing. And for her even the physiotherapist is important, because many of the women when they are pregnant, they try to avoid the physiotherapy because they think that the fetus may get affected, but that is usually beneficial for them, especially if they are prone for infections, pulmonary infections, for the to make the FEV1, that is the lung function, good. So physiotherapy is important for them. And during intrapartum period, so usually they can have a vaginal delivery. There is no contraindication for having a vaginal delivery, but usually cesarean is done only for obstetric indications. But usually they tend to develop pneumothorax if they are doing a repeated valsalva, or if they are repeatedly doing increased pressure. So that's why usually instrumental delivery is indicated in them, as in this patient. So prolonged pushing is usually discouraged in these patients, and breastfeeding and contraception is usually encouraged in these patients.